I want to thank my friend and neighbour, the member for Bolton North East, for securing this really important debate. And as she has said, our other member for Bolton West has a prior commitment and so he's not able to attend. And the reason we're mentioning is that the three of us work very well together in campaigning on many issues which are of concern to our constituents. One of the things we do is have a regular meeting with our Chief Executive of our hospital, which we did last week only, to raise these issues. So healthcare in Bolton is really important for us, and it is one of the most serious concerns raised by our constituents. When people in Bolton talk about the NHS, they are full of respect for the doctors, nurses and the frontline staff. Their frustration is not directed at the individuals, but at a system that leaves them waiting for months without answers or support. One constituent with serious heart condition told me that she had waited more than 1 year to see her cardiologist at the Royal Bolton Hospital. At one point, she was informed that the waiting list had actually been closed. She then paid privately to be seen, but then her appointment finally arrived 1 year after her last inquiring about it. She said, "I do not expect luxury, I just don't want to be forgotten." Ahead of this debate, I invited constituents to share their own experiences of healthcare in Bolton. And what I received were not statistics, but stories of worry, delay and sense of being left behind. Parents spoke about their children waiting for assessment. Women described living in pain while waiting for treatment. Older residents asked whether their names still even existed on any list at all. People said it was almost impossible to get a GP appointment unless they're online at 8 a.m. Others described the long phone queues with no certainty of being able to secure an appointment and being told that they would need to call back the following day or try again. And many spoke about digital systems that shut people out, especially those who are elderly, disabled or unwell. There were accounts of hospital letters arriving late or appointments missed because no update had been received. Parents of children with mental health needs said they were given information sheets instead of meaningful support. I hear their concerns and this must be addressed. I recognise that the secondary care is outside the Minister's direct brief, but obviously we cannot separate primary and secondary care when patients are stuck between them. When referrals disappear and no update follows, it is the GPs who are left to manage anxiety without any information to reassure or support their patients. Communication must be treated as part of care and not an afterthought. In general practice, the concern is not only about access but about continuity. Constituents tell me they never see the same doctor twice. They repeat their story at every appointment with no sense of follow-up or a clear plan. When ongoing conditions rely on repeated retelling rather than joined-up care, confidence in the system is lost. A primary care needs support to provide consistency, not just capacity. And mental health is an area that is deeply worrying. In Greater Manchester, the number of people waiting for adult ADHD assessment has risen sharply. Some of my constituents have been waiting 8 months or more without being allocated a clinician. Parents spoke to me about the experience with CAMS, where children in real distress are waiting for months and months for assessment and intervention. And without this early support, families are being left alone to cope. Another area is women's health, where the disparities are clear. Girls born in the northwest can expect fewer healthy years than those born in other regions. Manchester University NHS Foundation, trust which serves parts of Bolton, has the highest gynecological waiting list in England. Women have been described missing work, living in pain, and caring for families while waiting for basic investigations. So I welcome the government's women's health strategy and the development of Women's Health Hub. In Liverpool, we have seen Hub bring contraception, screening and menopause care together in one place. Bolton should receive the same opportunity to deliver accessible women's care in community settings. Now, as chair of the All-Party Parliamentary Group on Dentistry and Oral Health, NHS dentistry is facing existential threat. Almost 14 million people were unable to access dental care in early part of 2025. And since 2010 to 2024, expenditure on dentistry has gone down from 3% to 1.5% of the NHS budget. And whilst we welcome 700,000 new appointments, but as the government itself has accepted, we actually need 2.2 million appointments. Morale amongst NHS dentistry practitioners is all-time low, and many are leaving. The Health and Social Care Committee in 2023 said that the current dental contract is not fit for purpose. It needs reform. Another issue that's taking up time is that there are dentists who are qualified, but in order to be able to practice, they have to register themselves. And that process seems to be taking very long time, and it's an administrative process, not a one for assessing professional clinician requirement. So that needs to be addressed as well. Now, I'm told by many residents that they can't get dental appointments and often are living in pain and untreated problems. I myself personally have had to ring a number of dentists to get appointments for their constituents. Now, I know the government has a 10-year plan for NHS, but frankly, dentistry cannot wait 10 years for this to be resolved. And finally, I want to address, we can't discuss healthcare in Bolton without confronting inequality. 1 in 4 children in the Northwest grow up in poverty. Delayed treatment, poor health, limited support are not separate issues. They're experienced by the same families. The 10-year health plan must deliver not only nationally, but locally in towns like Bolton, where need is the greatest. To conclude, my constituents are not asking for perfection. They're asking not to be forgotten. They want to know that if they seek help, the system will acknowledge them, guide them, and not let them fall between services. If we are to restore confidence, we must ensure that patients are not lost between primary and secondary care, and that dignity and fairness remain at the heart of healthcare delivery. With focus, coordination, and commitment, I believe that we can deliver the timely, compassionate care that people of Bolton deserve.